Hi, my name is Taryn Townsend, and I am a senior speech language pathologist at Texas Children's Hospital in Houston, Texas. My day-to-day work revolves around the pediatric intensive and transient intensive care units. I am also in the early stages of pursuing my clinical doctorate degree in speech language pathology at MGH Institute of Health Professions in Boston, Massachusetts, where I also received my master's degree. Having acquired my certification as a brain injury specialist in 2021, I want to obtain my doctorate degree to continue to demonstrate a higher level of clinical expertise and bridge the gap in implementation science for many critical areas in pediatric medical speech pathology. My clinical passion revolves around acquired brain injury, and specifically pediatric disorders of consciousness and severe traumatic brain injury. A disorder of consciousness can be described as a child in a minimally conscious state, coma, vegetative state, or a more appropriate term, unconscious wakefulness. The actual number of children living in a disorder of consciousness is increasing in developed countries due to improvements in intensive and critical care, as well as improved access to life-saving interventions. As this population at hand grows, the practice guidelines and well-researched evaluation and treatment tools medically and in the field of speech language pathology are lacking due to the low level participation abilities and minimal interactions within the population. Many rehab clinicians don't know where to start. Limited research in adolescents to adults has been beneficial in determining that receiving specialized early treatment at the acute care level for up to 90 minutes daily has shown improved consciousness and body function. More patients even transition to inpatient rehab units. Early family education and engagement has also demonstrated improved outcomes for patients to return home rather than ending up in a long-term nursing facility. Despite this limited research, especially in pediatrics, what we do know is promising. So why can't we effectively contribute to the literature? Doing clinical trials and research on such a vulnerable population is tricky, especially in children. There are unique ethical considerations within the population. Benefits versus risk, respect, informed consent. I can go on and on. Some facilities provide arousal and responsiveness teams that are already established around the world, but can also be controversial and demonstrate limited effectiveness for patient outcomes. So where do we start? My Capstone project is geared towards evaluating the current literature on the practice guidelines involved with pediatric disorders of consciousness in my current setting. I hope to take a retrospective account on when and what speech pathology interventions were initiated, data collection, and emergence from a disorder of consciousness, especially across the last 10 years. I want to even take a broader look at how, when, and if other rehabilitation therapy measures were initiated from the ICU to the acute floor and into our inpatient rehab units to see what level we are currently functioning at. As Texas Children's is the largest children's hospital in the United States, I hope by taking a look at our own clinical practices and collaborating with similar settings in the future, we can move towards developing a streamlined process of interventions and guidelines for the rehabilitation of pediatric disorders of consciousness as early as feasibly appropriate, with eventual strong quantitative and qualitative research designs to then specifically determine strong evidence-based clinical practice across the neuro continuum. I believe my approach is important as a starting point for quality and process review and lead into quality and process development and improvement that can be adaptable to the everyday clinician with this population everywhere. Thank you.